Welcome back to another episode of Jaw Talk. I'm your host, Dr. Tiffany Lamberton, and we're about to dive headfirst into part 2 of my conversation with Hallie Bulkin. If you thought the first episode was a mind-expanding journey, buckle up because we're about to elevate the conversation even further. Hallie's a force to be reckoned with, a business mentor, podcaster, feeding specialist, certified myofunctional therapist, and speech-language pathologist. Her leadership as founder and director at Little Sprout Therapy and Metro Myo enriches the landscape of pediatric practice. In this episode, we'll unravel the secrets behind a collaborative approach that supercharges oral health and discuss patient symptoms for tailor-made solutions. Hold on tight as we boldly debunk myths about orofacial myofunctional therapy and get an exclusive glimpse into Hallie's crystal ball as we uncover her upcoming endeavors. Tune in with your listening ears because we're about to ignite your curiosity. Are you excited, intrigued, thrilled? I'm sure you're thrilled. All right, let's get started. Quick legal disclaimer. All information in this podcast is the opinion of the speakers and not meant to be a substitute for a diagnosis and consultation of a qualified healthcare provider. What's crazy is we're starting, this isn't new to physical therapists because we know about the myofascial systems and the, planes and things like that, but it's just what we're seeing, with the TMJ is if you have one joint that's more injured than the other, or maybe some disc displacement, you end up having, kind of the whole chin that shifts to the short side, you have the ramus height of the mandible that doesn't develop. And then you have muscle compensation, and then you have fascial, restrictions. So they lift up their tongue and they're more restricted on that side. And then you look at Atlas, and Atlas is rotated, maybe more on that same side that has more damage. And so again, I think, I was talking to my colleague, Dr. Drew McDonald, who's an airway orthodontist in Albuquerque, New Mexico. And it's just you start to see these patterns as a practitioner. And like you said, once you've seen it, you can't look away. And so I think that we've got to have, these teams of people, whether it's, whether you're an orthodontist or a general dentist, but we've got to be pulling in the people that are doing some of the body work, whether it's, an AO chiropractor. I'm, kind of pro physical therapy because I feel like physical therapists, we look, at, musculoskeletal imbalances, also joint mechanics, but also we're trying to educate you, how can we change these patterns either through, therapeutic exercises or postural retraining, or, it's not just I'm just going to manipulate your neck and you go on your merry way and come back and see me 3 times a week for the rest of your life. I want you to see me for 5 or 6 weeks and then be okay, I found the way to, sort of change those movement dysfunctions of whether it's joint, muscle, and then be able to correct some of that. So that's the part that I think PTs and dentists need to be working together, or OMTs. We all need to just be like I said, we need to form this big directory or these big centers where we're all, kind of working together, because that's how we're going to change kind of the paradigm of how we've been looking at our patients, especially in dentistry, because like I said, dentists, we were so fixated on the bite and the occlusion and how the teeth fit together. Well, yes, that's absolutely important. But to me, it's a tricentric concept, right? It's how the teeth fit together, but it's also the head and neck too, and how all of those systems are working together.
Yeah. Well, and I love that you have the background of the PT background in addition to dentistry. I think it's so very cool. And that was one of the things I loved about our conversation when you were on my podcast was it's such a unique perspective that many dentists don't have. Obviously, though many dentists don't have a PT background. So I just think it's very interesting because you do understand things on, I think, a deeper level, both the bone and muscle and how everything it inner works, the inner workings of all that. So I love that. I think it's very cool.
Yeah. Well, and the thing is, like I said, with the ability to, maybe now do cone beam CT, in our office, you guys as speech language, you're not going to be really taking those, but it's so helpful to have that information, right? When you're treatment planning, to know, what are those numbers? What do those mean? And, I think our oral maxillofacial radiologists are an essential part of our team too. I had Dr. Tamini on a month ago. She works for Beam Readers, and she's just fantastic. I feel like I know a lot about imaging, but like, I also want to have that overread from her, and, just about like, okay, I'm seeing these things with like this atlas rotation. I'm seeing this with the airway. I'm seeing this, but I also want to make sure I'm not missing anything, right? I want to make sure I'm not missing like a big malignancy or, so I think where I'm at is like, I kind of want to straddle that between like evidence-based dentistry, but also that integrative approach too, being willing to kind of pull in some newer things, which again, myo's not new, but to a lot of dentists, it's kind of new. They're like, ooh, what's myo? All of a sudden it's kind of like exploding in the dental world, where you guys are like, da, 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 we've been doing this for a long time, so I think that, like I said, building those teams of people that we can see our patients together with, and like you said, kind of have those new eyes, and not being afraid to be like, okay, like the literature is still new on this, but we're going to try it and see how you respond to that. So I think that, the consumers and our patients, they need to be educated about that, and other practitioners need to be educated about it as well.
Absolutely. Absolutely. And I think it's really cool too for us, like to get those Beam Reader reports and to have conversations with our dental colleagues and really fully understand what's going on from your perspective, because what we do in Myo is going to be based on the results of that report. If someone's got, pain in their jaw, their Myo exercises may look very different than the next person who has a well-functioning, TMJ. And so, it's one of those things where like we can do damage if we don't know what we're working with. And you don't want to pop somebody's jaw and do these, like, there's exercises called like jaw pops and like other things. And it's like, you don't want to do these things if somebody's, doesn't have a healthy TMJ. So yeah, anyways, and we obviously get a lot of other helpful information from those reports. But I think that for me, that's like one of the sections I always go right to right away is like, what does it say about the TMJ? I need to know. I want to see, let me see the images, which is always very cool to see now that I've seen a number of them and I understand them a little better, because that is not my area of expertise. And that is not something that I've ever been trained on, but it's definitely something that's so fascinating. And I think so important in like the work that we do.
Well, and that's the thing, is that I think that we need to understand if the whole, skeletal system, including the TM joints, if they're healthy enough to go undergo the proposed treatment, whether it's myo, whether it's surgery, whether it's orthodontic treatment. I think having that information is so vital, instead of just like waiting to see like, oh, well, we're going to try these exercises, and oops, if you get worse, oh, sorry. I think that patients really want to know what their anatomy is. And, in my own kiddo, we worked really hard to get an MRI of his TM joints, and that was not easy, but he had multiple things that had happened with injuries and trauma to the jaw joints. And like I said, I was seeing, that growth and development that wasn't quite fitting together, where, maybe his nasal pharyngeal airway space, we'd address that. Maybe, we'd address tonsils and adenoids. That was getting better. We looked at, tongue tie and all of that. But there was still that underlying skeletal thing where his disc was slightly dislocated more on one side versus the other. And that was causing a deficiency in both the maxilla and the mandible. And so, to me, us as dentists and orthodontists, we can have the most impact on that oral pharyngeal airway space by encouraging that growth and development. But we only have a window of time, right? With girls, especially, they're done growing by 15. And so, what frustrates me is the orthodontist that doesn't really want to look at that big picture and just wants to jump into a quick, well, yeah, they have anterior open bite, they have class 2. Well, we don't need to do myo. We don't need to do imaging. We don't need to do any of that stuff. Let's just fix the teeth. And then, after the fact, then that 15-year-old girl all of a sudden has clicking and popping. All of a sudden she has migraines, she has headaches, she starts to relapse. And so, Dr. McDonald was talking about how his failures were actually what drove him to find out more information. What's happening? Why am I having orthodontic relapse? Why are we even doing jaw surgery on patients and then they're relapsing, or having these kind of like subpar outcomes, where you're like, okay, what was happening under the surface with the skeleton and the musculoskeletal system that caused this to not, it's just like, we don't want to be so quick to like, oh, that patient just didn't wear their retainers, okay.
Yeah, right. You're like, right. That's the problem here.
Then you look at their joints and their joints are actually actively breaking down. And so that's what makes me so crazy about appliances, right? So let's say you have that female patient where their disc is just teetering on the edge, and then you put them into an appliance and all of a sudden that disc dislocates the rest of the way, and it's always like, oh, well, they'll adapt. But the thing is, if you lose that disc space, then you blow through your retrodiscal tissue, then you're bone on bone, then the condyle starts remodeling, and you see these condyles, I talk about it in my, courses is like, instead of a nice, like, convex ice cream cone, you look at from the side view, it looks like a little high-heeled shoe because that poor little condyle has, just deteriorated. So you were talking about bone remodeling. And so what does that do to the bite? And what does that do to the muscles? All of a sudden you've lost that dimension. And so that mandible is sitting back further. It's seating up in the socket more. All of a sudden, you have hypertrophy of the masseters, and they're like, oh, well, I did Botox in my masseters. Well, why did you need Botox? And I mean, I definitely use neuromodulators in my practice. I think it's a tool, but we have to diagnose our patients first. And so, like I said, if we're not diagnosing our patients from the get-go, we're not treating our patients adequately, in my opinion. It's all about the diagnosis.
Oh yeah. Well, that root cause, like getting down to the root. And it's the more we keep talking about like root cause interventions, like what caused this? How did we get here? What, like we were talking about before, everything just snowballs and the compensations just continue to build. And then you get someone who's compensating with all these symptoms that we've talked about, today. And it's one of those things that it makes me a little bit mind blown to kind of go like, why aren't more professionals asking these questions? Yeah. And learning from their failures. Like I was the one who was sitting here going like, I don't want this kid in speech therapy for 10 years. Like, how do I get them graduated in like 6 months? Like nobody wants that. I don't want anybody in pain. I don't, now I'm getting these adults, middle-aged adults we get like who are the exact patients you're describing. They're in pain. They're non-functional in their daily life. They've been to so many providers that have turned them away. They've been diagnosed with PTSD because of their like massive sleep disorder breathing and all the things they've been, gaslit into believing about themselves because no one's listening to them. It's just, we're in a very like sad space right now. And when it comes to getting the medical care that you need most, unfortunately, for some of these patients. And, that's why I love podcasts like these, because I just feel like a patient could even stumble upon this and hear this. And that's what started happening with mine. I created it for professionals. And all of a sudden we were getting like patients and moms and dads, like their parents are like, oh my gosh, I think I have this. I think my kid has this. Okay. They were reaching out to me. Who do we contact to? And I'm like, I would say DM me. If I can find somebody to refer you to, I absolutely will. Because if I can just find that one point person who gets it, even if they're not the person you end up with, they can probably refer you to the right person. And just finding, like we talked about earlier, finding that person, especially as a patient who's not in this space, it's hard. It is really, really hard to even know where to start, who to start with, who do you trust? You're going to get 3 different people saying 3 different things. Right. And so anywho, we go off on that whole tangent a whole nother day, but it's, I think it's one of those things where it's a real issue. The symptoms snowball. And I love that like you're really bringing the jaw into all of it, because I actually feel like, especially the TMJ, I feel like that is not something that we hear a lot about.
Yeah. Yeah. Well, and my little graphic is like a triangle. It's Airway, it's Myo, which for me includes both like tethered oral tissue, it includes myofascial systems, it includes the musculoskeletal system, and then TMJ. Because in my world, the TMJ really just gets ignored a lot. You know, a lot of dentists don't even know how to palpate the muscles. They don't want to like look at the neck, and you know, they're just like, I want to drill on teeth, you know, but it's like, do you also want to know why your restorations are breaking down? You know, why are your patients grinding? Do they just need, you know, Botox in their masseter? Is that the solution? Because you can do that so quickly in your office. And, you know, I think we just need to like hold ourselves to a higher standard of care and slow down and get that diagnosis. And unfortunately, our healthcare system doesn't lend itself to that. And that, you know, TMD kind of ends up being this horrible gray area kind of between medicine and dentistry where it's not covered well. You know, like you said, patients are going from provider to provider, getting, you know, different information, different things, and no one's really diagnosed them, you know, from the very beginning, because, you know, my treatment plan that might work for me may not be the right one for you. But I think patients really need to know what their anatomy is, and, you know, then make that decision. You know, do I need to do orthodontics? Do I need to do expansion? Do I need to do surgery? You know, that decision is very personal. But what I feel like my mission is, you know, and I have a small fee for service practice where I'm like, I spend 60 minutes with you. I spend that clinical exam, and then I determine, and not everybody gets imaging and not everybody gets all the same imaging. I'm not saying like everybody gets the same protocol. You know, it's very specific and it's very individualized. But I mean, I don't want to just quickly throw, you know, a neuromodulator into the masseter when they may have metastases from breast cancer and that's what their jaw pain is from, you know? And so that's where, you know, that adequate imaging can really come into play and make sure that we're not missing a key piece of the puzzle.
Yeah. Yeah. Well, and I love it. And I love, you sound very like individualized approach. You know, you are able to spend time with patients because you're a fee for service. And, you know, it's like us too. My practice is the same way where we don't accept insurance, but that also allows us to give the top level, you know, care that we provide, which we actually think is most beneficial for a lot of these patients' needs. But, you know, it's hopefully one day in some magical universe, our healthcare system will catch up to what we do. We can all wish and hope and dream, right?
Well, I want to give our listeners a little spicy content. Tell us what makes you, if you see something on social media or maybe hear from like another healthcare provider, what makes you kind of want to scream about like some misinformation about your area of OMT?
So I think the biggest thing is that, like I was talking about earlier on, there's a lot of speech pathologists who don't believe in myo. They think it's like a unresearched, you know, made up something to go after people to take their money. And I'm like, what? I'm like, wait, hold on. So you want to keep this kid in therapy for 10 years to work on a speech sound, but they were dismissed from my practice in 6 months because now that their orofacial structures function, they can now make that speech sound and we barely had to address it. Cool. Got it. Okay. So there's that one. Then there's also the individuals who do like tongue tie assessments by just looking at photos and, you know, saying, yes, this is a tongue tie. No, this is not. And it's not just my space. There's a lot of dentists that do this as well, where they'll do like a tongue tie assessment. And I'm like, well, what did they do? Was it functional? Did they watch you have a snack? Like, can you just explain to me what happened? They're like, oh no, they just like, I stuck the tongue, you know, my child can stick their tongue out. So the child's fine. I'm like, no, dentists and pediatricians, sticking your tongue out is not an indicator of whether you do or do not have a tongue tie. Also, just looking at the tongue is also not an indicator. We need a functional evaluation. And I like recently just recorded a podcast episode on what that actually is and means. So I won't dive into it, but there's that. And there was one other thing too, and it's now escaping my brain, but it's mostly, you know, people not believing in tongue ties. And I'm like, so you're discounting all of these stories from parents of children and adults and young adults who share all the benefits they had after having a tongue tie release, after growing their airway, after having myofunctional therapy. That's not real? Okay, got it. Cool. Awesome.
Yeah. Well, I would say too, and I'm going to like pick on Gwyneth Paltrow right now. I mean, she's a celebrity and, she's talking about, using ozone rectally or like these supplements or, she's kind of like grifted off of things where people are like, oh, well, she's advocating this. This is like science. And it's like, okay, you have zero credentials in the healthcare industry space, and I guess like that's what kind of like grinds my gears is like where you see people who have absolutely no credentials in, let's say, TMD. Okay. I mean, if I wanted to sell like the Tiffany appliance and say like, this is going to change, or like maybe sell some supplements, I mean, I just feel like that's so unethical. And like, I'm under obligation as a licensed dentist to provide evidence-based dentistry and to provide a high standard of care. So that's where I get like, so like,
that's happening. That's happening actually more and more in the myo space where people are saying, oh, myo is not regulated. It's not a regulated field. We're like, myo is not a field. Myofunctional therapy is a type of therapeutic intervention provided by licensed healthcare professionals that either need to be licensed as SLPs, OTs, PTs, like PTs, RDH, or like a dental professional, like DDS, DMD. Like it is regulated under our licensure, but now there's people out there teaching it to whoever will pay them. And there's like a music therapist who's doing it and they have no credentials to be providing myofunctional therapy. And then we get these patients and we're like, you wasted thousands of dollars and you don't look like you've ever had a day of myo.
Yeah.
We're starting ground zero. So like, honestly, if I could like, not that the other ones don't grind my gears, but like this one, it makes me angry for the patients, because in all honesty, it's issue of, like you said, there's an ethical obligation as a practicing, therapist who's licensed in this area, but then they're now applying it to babies. And now they're calling it like baby myo, toddler myo, and a lot of non-feeding therapists are calling it myo. And now we're actually getting a lot of dentists calling it myo because these other people are calling it myo. And we're going, these are the goals of myo, but that's the only way you can really truly address that is with a pediatric feeding therapist, because it's so much more involved, like when we're looking at these little ones. And the Oral Motor Institute has actually been doing some advocacy around this online and trying to educate. And I've done this in the past too, but I'm like, hopefully all of us together can kind of like educate on the difference. Like, yes, we can still help your child, but it may be called something different. It may require a different licensed individual at a certain age versus a later age, under the age of 4, for example. But anywho, that's a whole big conversation for me.
We could go a lot of different places with that one, right? Yeah. Well, my one too is like, what's happened to fluoride? People like all of a sudden decide that like fluoride was like evil. And, I'm active with like our dental association here. We did some, we were, advocating for the legislature where, they were just like, we want to take fluoride out of this community. And like the bill was just about like, we want to educate the community that the fluoride is being removed from your water. And they were blocking that. I was like, it's education, so. Anyway, that's another one where I'm like, where is all this anti-fluoride coming from? Is it because you're trying to sell hydroxyapatite toothpaste? Is it, is it really bad? Like, anyway, that's why I said, just trying to like keep up with all these different issues and also be like, okay, evidence-based dentistry, like we know that not all studies are good. And, there are some like sham studies and we've seen kind of like sort of the acceleration of maybe some of that like misinformation. And so I just love that you're like a light and a shining star in the OMT world, just, educating and advocating for, like you said, evidence-based, care and therapeutic interventions for our patients, because that's what we all need to be, striving for.
Well, thank you. I tried to take some of those things that were really bothering me and things that people were complaining about, and I tried to turn it into a positive direction by like going, okay, well, if this doesn't exist, like, can we provide that? Can we actually give what everyone's kind of seeking? And, and that's really that's just how I've moved forward in everything. It's what's lacking? What do we need? What additional supports do you need? And, one of the biggest things that I heard, other than like what I shared earlier about just leaving a course and being more confused, but it was like mentorship. It's so hard to access mentorship and to even find the research because it's like locked under all these different journals, or it's in all these different journals. And, so even though like we obviously can't take these research articles and hand them over to people because that's not legal, what we can do is get access to the articles ourselves and my team, and then review them and provide a review of these different articles to our members so that they have an idea of like what the research says. And then they can have more, research-based conversations with, evidence-based conversations with other providers, with families, because those were like two of the biggest things, research and mentorship. It just kept coming up. And I was like, there is so much research if you know where to look for it. So much of it is in like related journals or other professionals' journals, like not in the SLP journals, if you will, when it comes to like Myo and Airway and tethered oral tissues and all that. And of course, there's not enough surrounding topics like tethered oral tissues, but there's more coming out. And I think, you had talked about earlier, just like being open to the new research and understanding, like one of the things I constantly hear is like research is 17 years behind. Like it takes so long for the research to catch up to practice that, sometimes we also kind of have to take a leap of faith and like obviously do things ethically and, don't be dangerous, but use your common sense and use what you do know as a provider and what you're allowed to do under your license, and see if you can help your patients. And maybe that'll lead to further research because now we have different questions to ask and different experiences that have been had. And now let's research that further. So, I love when people are like open, at least to a conversation, because I think that's where this all moves forward.
Absolutely. And we can all help each other for sure. So tell us a little bit about what is the exciting stuff that's happening in your world. Tell us a little bit about your course. Obviously, we'll link some of these things in the show notes, but tell us a little bit about all the exciting stuff that you're building.
Absolutely. So everything can be found on my website, HallieBulkin.com. Each of the courses has their own website. So the feeding one is feedthepeds.com. The Myo one is themyomethod.com. The membership is themyomembership.com. The podcast is the Untethered Podcast, it's untetheredpodcast.com. But basically, the exciting news is I am moving into starting like more of a business this fall, or we're not launching it this fall. I'll probably launch like end of the year, early next year. We're starting to plan in Q3, where I've had so many people coming to me asking about like, hey, can you help me do what you do? And can you help me, like I want to create an online business, or I want to create a course, or I want to, do whatever, like something related to what I've done. And I have been coaching. I've coached private practice owners for years now, like as a mentor and, paid mentor and everything. But then I started to move away from that into doing more of this where I'm mentoring, educational businesses. And so now I'm actually starting an actual business surrounding like mentorship for educational business owners. It could be in any educational space, not just Myo and not like the current space that, I exist in, because I love it. I thrive. It like lights me up. It's very fun. And, to be honest with you, at the end of the day, a lot of these therapists and medical professionals come to me because they're burnt out and they're like, I love what I do, but I need to do this differently, or I need another like income stream that kind of takes me away from my daily practice. So I'm still doing that, but I also want to do a little bit of this. And it looks different for everybody, but that's the exciting part for me, is that it's really cool to kind of help others kind of shape shift into like their new identity and who they want to be and what they see for themselves. And that's been really fun.
Well, I want to be a client.
Okay.
That's what I want for DMD Collective. Sign me up.
Perfect. Awesome. And I just like dumped my tail over myself. That's okay.
No, because what I've discovered is like you could have the best courses in the world, but if nobody knows what you're offering, or, maybe you're doing a little bit of this and that, and you're on this platform and that platform, I've been all over the place trying to do this and not making any money. So sign me up.
Done and done. Yeah, it's like one of my mentors. One of my mentors is like, if you go scream in the middle of the ocean, it doesn't matter who you're screaming at or what you're screaming about. Like, who's going to hear you? So yeah, but it's one of those things too, where there's a lot of noise online these days. And so just like, I think learning how to break through that noise is like something that is exciting for me to help other people with, because things are different than when I started, but like I'm also going to be starting a whole new business, and I'll be like right there alongside basically implementing everything I've done and learned. And like, I'll be like, look, it actually works because I did it in my own new business too.
Yeah.
So yeah.
That's
Fun time.
amazing. Well, like I said, I want to be a client because I look at what you're doing as like the goal and the benchmark of where I want to be. So kudos
Oh,
to you. I'm so excited.
thank you.
And
Yeah, well, we'll
like I
chat.
said, it's gonna be amazing. And you're so good at what you do and you draw people to you. And so I think when you're authentic, that really shows.
Well, thank you. Thank you for that, because I've always said I'm unapologetically myself. So take it or leave it.
Yay, yay. Well, thank you so much for your time. This has been amazing. Like I said, I was so excited to have you on. I really appreciate you being willing to come on to Jaw Talk with Dr. Tiffany. And like I said, we'll include all of that information for our listeners. So thank you, Hallie.
Thank you so much.
And there you have it. This brings us to the end of Hallie's two-part series. Thanks for listening to Jaw Talk. I have great news for you. For those seeking to understand more of the topics that we discussed, I encourage you to visit tmdcollective.online. There you'll find an array of resources and information that will help your learning journey. My course, You've Hit a Myo Wall, Now What, will help deepen your understanding of the jaw joints as it relates to overall craniofacial development. If you're finding value in the content, I'd really appreciate a review in whatever podcast platform you're listening to. Your support serves as a cornerstone, ensuring that I can continue to bring quality content to this podcast. Stay tuned for upcoming episodes that promise to be just as fantastic and fabulous as we uncover remarkable perspectives and bring on other rockstar professionals. I'm so excited for what we have coming up on the show. So thanks again for being part of our podcast community. If you'd like to support the show, we do have a paid subscription on Patreon that's called the Tiffany Platinum. Check it out and please help support the show. Thanks a lot and have a great day.